Earlier this week, the Texas Rangers announced Jacob deGrom will not be back on the mound anytime soon. The two-time Cy Young Award winner will undergo Tommy John surgery to repair a ligament tear in his elbow. He just signed a 5-year deal with the Texas Rangers over the winter, and he's likely going to miss the remainder of the 2023 season and likely part of the 2024 season as he recovers. Here to chat with us about this is Dr. Nathan Boes. He is the Director of Sports Medicine at Parkland and Assistant Professor in the Department of Orthopedic Surgery at UT Southwestern Medical Center. Thanks so much for joining us. We appreciate it.
Yeah, thank you. Thanks for having me today. I appreciate the invite. It's a privilege.
Yeah. So what exactly is Tommy John surgery? Is that named after someone?
It is, yeah. So Tommy John surgery is actually named after the former all-star baseball player, Tommy John. He was the first professional baseball player to have the surgery done in 1974 by Frank Jobe when he was playing for the Los Angeles Dodgers. And it's kind of a revolutionary surgery at the time because there were not a lot of great options for Major League Baseball players or really any overhead athlete at that time with this injury. So he went on to have a good career after the surgery, which you can imagine return to sport. And at that level is really something that is hard to do. So after the surgery, he went on to win about just as many games that he had won prior to injury after the injury. And he is the first one to kind of undergo that. And since then, there's been different modifications to the original surgery technique, but overall still very similar to that original, surgery that was done back in 1974.
I was going to ask you how it has changed over the last now 50 years with technology making improvements. Does it help with faster recovery time, or because they're talking about a year and a half?
Yeah, a great question. I think that's what I enjoy as being an orthopedic sports medicine surgery is keeping up with this. I mean, there's conferences that you can spend 3 days talking about this topic in a room, and kind of at the end of the day, we're still learning new things. But I would say the most recent update, when you injure the ligament, and what the ligament is a ligament is something that attaches a bone to a bone. So I have a model here basically of the elbow, but if this is the inside of the elbow, the ligament basically goes from the humerus here to the ulna, and it basically is a primary resistant to valgus force. So you can imagine when a pitcher goes up, he's putting a whole lot of force on the elbow and the shoulder to basically be able to reproduce that amount of velocity on the ball. So we think over time, and a lot of the professional baseball players, that ligament, kind of like a rubber band that gets stretched and micro trauma, that eventually it kind of just gives. It's a little bit different than a rubber band that, like Brock Purdy, he got kind of hit in an instant with a resistant to his throwing arm, and that caused it to snap acutely. The ligament is different in terms of how much wear and tear it basically has on it. And that goes to that basically factors into how we go to surgically either reconstruct it, meaning using a graft, whether it's from your wrist or from your knee, we're basically using your own tendon to reconstruct that degenerative and beat up ligament basically in the elbow. Or recently, and the recovery period from a reconstruction using a graft is about 7 to 12 months. So that's why they're, giving the time frame for Jacob. It's about that long. The most recent kind of surgical technique is looking at how do we get players back a little bit quicker. And it tends to be for these injuries that are more acute in nature, meaning kind of the resisted popping of the rubber band, versus younger players, because we're seeing an increase in incidence of this in the younger population, 15 to 19-year-olds. And that's not using a graft. That's usually more so suture and little bone anchors that we're able to put in and basically augment the already injured ligament, if you will. And that's allowing us to see, good evidence getting pitchers or throwers back at, 6 months, almost half the time.
Wow. Yeah. So are you saying like the gold standard is different for the age of the patient?
It a little bit has to do with, So the age, so really the age more so plays into how degenerative it likely is the ligament going to be. So somebody who has played and grown up from little league all the way through collegiate and into the professional levels, who, the likelihood of them being able to get back after a repair, which again, it kind of we're pushing and more is coming out with kind of the repair, but the ligament tends to be just overall generalization. The ligament tends to be a little bit more beat up. So it's falling in more so for the acute injury and even the injury pattern. So we get an MRI that basically shows where the ligament is injured. And it tends to be the ones that aren't ruptured mid-substance, meaning in the middle of the ligament, but are a little bit further down in the elbow, closer to the attachment down here. Those we're seeing good results with the augmentation or the repair versus the graft reconstruction. So there's a lot of factors that play in: imaging, age, how long it's been going on, and kind of how you injured it.
There's been talk about the fact that this is the second time he's going to have to go through Tommy John surgery. And as history has shown, really only one person has come back from having a second Tommy John surgery, but it happens to be one of his own teammates, Nathan Eovaldi.
That's a great point. I think, we worry a little bit anytime we're going back and doing revision surgery, kind of what is that going to look like? And, how do you rehab that? And it's kind of uncharted waters at that point. Like you said, there's not we do know in adolescence, elbow and shoulder injuries at an early age, there are statistics showing that the return to sport, and again, at that level of play, although good with Tommy John surgery, is about 70-80%. So you add on the fact that it is a revision, those are some kind of hurdles that he will have to go through. But I'm sure him, the sports medicine staff, the rehabilitation, and the surgeon are all, optimistic. And, if he's got the spirit, which I know he does, it's still something that hopefully he can overcome.
Absolutely. What are some other common injuries that you see through baseball players?
Yeah, so I would say undoubtedly the highest incidence of injury in baseball player would be elbow and shoulder injuries. Just because of the adaptation kind of factors that an arm goes through from the time you're an adolescent all the way to Jacob deGrom's kind of level and being able to throw a ball 100 miles an hour. We see certain adaptating factors basically that allow him to do that, whether it be in the shoulder or the elbow. And kind of with that comes all kinds of stresses to the elbow and the shoulder. So shoulder injury, elbow, and then probably followed by a close third would be knee injuries. Not as common as football, where we see the ligament in the knee that's kind of akin to the UCL as the ACL in the knee. And during football season, we see a lot of more knee and more upper extremity, shoulder, elbow kind of injuries in baseball players.
What about the technology? You mentioned the fact that ACL, sort of similar as what he's going through. The technology for ACL injuries has improved so much. Are they starting to use those kinds of techniques with these kinds of Tommy John surgeries as well?
Yeah, absolutely. So the kind of the newest kind of technique, I guess, is like I mentioned, is with the repair and the augmentation. So using kind of biocomposite, which are basically little screws that we're able to put into the bone that then adapt and grow into the bone, basically, that are then fed to suture that can kind of add augmentation to a ligament and basically take some of the force away while it allows the ligament to basically heal. In the knee, we see less success, but we're also, it's very early on too, but looking at because traditionally, the gold standard is a reconstruction of the ACL, but we're also looking at factors and ways to basically repair an ACL too. So it's exciting new kind of frontline sports medicine, if you will.
Now, we know that, our Rangers, whether it's deGrom or anybody else, they're going to get the top of the top treatment and care when they're going through an injury. When you have parents that might be listening and they've got kids that aspire to be like these professionals, at what point does having a good, solid orthopedic doctor, play a role in upbringing a young athlete?
That's a great question. I think it's vital. If there's a takeaway from this injury to all levels, it's basically we're seeing these injuries in a younger and younger population, and I attribute that likely to how competitive sports are at every level, advancing basically to every level. So I think if there's one takeaway, it's and I've got a 5-year-old, so that's something that I'll be preaching to him as well. But it's to avoid sports specialization. So don't put all your eggs into baseball and play it year round. Be well balanced. Play football, play soccer, do gym. Other activities. We do know that not taking the proper rest, fatigue of the arm, early signs of pain at the medial elbow or the inside of the elbow are all reasons to go, seek out somebody and look for somebody. But I think there's a lot we can do from a sports preventative standpoint. And the MLB has actually come out with a list. It's called Pitch Smart. It's on their website. You can go and look per age, what are the recommendations? And this is all based on evidence and how do we avoid, this kind of growing trend within baseball? Because we all want to see the Rangers do well. And we all want to see the next generation of players continue to kind of push the envelope. And I think there's a lot of awareness that can be spread to kind of get there.
Absolutely. That is Dr. Nathan Boes, who is with Parkland Hospital. He is the director of sports medicine, also a professor of orthopedic surgery at UT Southwestern Medical Center. Thank you so much for the time. We really appreciate it.
Absolutely. Thanks for having me again. Go Rangers.